I've been waiting for a long, long time for this professor. He's a doctor, he's a physician. He's probably the most accomplished guest that I've had on the show, and maybe the top five out of every single one of the guests that I've had. Why? Because he's not only an author of 14 books, over 200 medical reviewed, peer-reviewed papers. He's just an absolute hero. He runs a podcast. I don't know how he's done it. He's even got a needle. I've been injecting regenerative medicine techniques for 15 years. He's got a needle named after him called the Lufkin needle. It's an absolute privilege to have him on show because this man is courageous. His calling is bold. And he's written a book that we take to all our corporate clients and to our business owners called Lies I Taught in Medical School. Every single one of you listening, no matter where you are in the world, you need this book, and you need to ask your physician certain questions. Yes, you don't trash your physician. You go up to him, you ask him questions, and you get this book because it's going to take you step by step. So it's a warm welcome. I've been waiting a long time. He's huge on LinkedIn. Welcome to the show, Professor Dr. Robert Lufkin.
Oh, thanks, Steve. It's a pleasure to be here, and looking forward to our conversation.
Brilliant. I firstly got to say you're courageous. Your calling is so amazing. I want to know how the medical schools took it and how your colleagues have taken this book that is a #1 New York Times bestseller. You've written 14 books, but this book, seriously controversial, but I think it's very, very important. How did the medical schools take it? Because you were part of the system.
Yeah, that's a great question. I mean, last time I checked, I still have my job at my medical schools here in California. But seriously, I think that the whole title is intentionally attention grabbing. Some would even say clickbait. But it underscores a sort of a principle that about medical education and science in general, that it's based on a quote of one of the most famous physicians of all time, who made one of the most famous quotes about medical education, and that was Sir William Osler, almost 125 years ago. He was giving an address to a graduating class of medical students on the day they graduated medical school and became doctors. And he said, "Gentlemen, we have a confession to make. 50% of what we've just taught you is incorrect.
Wow.
And furthermore, we don't know which half it is."
Sure.
And that speaks to the nature of science and medicine, especially, that it's continually evolving. And, what we thought was the truth before is changing all the time. And I would say even at an accelerating pace today because of the internet and AI and all these things.
Yeah, that's amazing. And have you stopped teaching these lies at medical school at UCLA and USC? I know when I've watched your presentations, you've always said, listen, this is my opinion. This is not the opinion of the universities. But I mean, if you're a patient listening out there, no matter where you are, you buy the book, you read the book, you address your physician in a respectful way. If you need to buy the book for your physician, you buy the book for them. Now, we're not anti-Western medicine. There's a place for it. But have you started changing your teaching at these medical schools?
Oh, definitely. I mean, I no longer knowingly, and I don't think I ever did. And in my heart, I believe most people don't, intentionally lie or intentionally do things that harm others, but these are unintentional lies, or that I believe are sadly, that many of my colleagues still teach. And to your point, the book is critical of Western medicine. I'm a product of Western medicine, coming from a medical school and teaching and all that. When I went to medical school in the 20th century, Western medicine transformed the lives of all of us, around the world. It made the world a much better place. The pills, the surgeries that were developed made our lives so much better, largely through public health measures and infectious disease and things. And even today, if I get hit by a car, I'm going to want, Western or allopathic medicine. It's not just in the East. In the West, there's good medicine in the East too, but I'm just saying conventional medicine. So even today, if I get hit by a car, I'm going to want a blood transfusion, my spleen out, my bones set. But the problem is, and this is what the book's about, in the 21st century, now we're one quarter of the way into it, we're facing literally a tsunami of diseases that were, although they were present in the 20th century, they're nowhere near the numbers now. And they're referred to as chronic diseases. And it's actually a pretty short list. Things seemingly unrelated, like obesity, diabetes, heart attack, stroke, cancer, Alzheimer's, and mental illness are the main ones. And the problem, and these are in biblical numbers, never before seen in history, even correcting for populations, something's going on. And the problem is when Western medicine takes the pills and the surgeries that were so effective in the 20th century against, the issues there, when they're applied to these chronic diseases, in many cases, the symptoms, they work on the symptoms and the people feel better. But the problem is, in most cases, they don't address the underlying root cause, which we show in the book is a common root cause for all these chronic diseases. Even though they seem very different, they actually have a common root cause, and the pills and surgeries don't really work on it. And I discovered this myself when I came down with 4 of these diseases, and that's kind of why I got dragged through the system myself.
And it's almost a story from pain to purpose, isn't it, Robert? I mean, at the end of the day, you probably wouldn't have seen these lies. Or like you said, I mean, you said this amazing statement in the book that just hit me. I trusted the science that couldn't be trusted. And here is someone who's in science, who's teaching, who's really part of the education, but not only teaching, who's a physician, who's seeing patients, and now you've trusted the science that couldn't be trusted.
Yeah. I mean, I'd like to say I did this because I wanted to make the world a better place, but no, not really. I was doing my thing as a professor, going along, minding my own business, teaching my own things, seeing patients, doing research, all that. Like I said, when I came down with 4 of these chronic diseases myself, I went to my doctor, and the doctor said, here's a prescription. Here are 4 prescriptions, in fact, 4 pills that you're going to take, and I said, well, is there anything else we can do, for this? I hear about lifestyle, should I be changing my lifestyle? And they go, nah, that really doesn't work. You're going to be on these pills for the rest of your life, so get used to it. And
Crazy.
at that point, I had young daughters who were in elementary school. They're now beginning high school, so it hasn't been that long, but I realized that, knowing what I know about chronic diseases, that this wasn't going to end well. I might not live to see their kids or, their grandkids and all. So it forced me to begin to question my beliefs, what I believed and what many of my colleagues still believe. And I realized, I uncovered that there's been a revolution in our understanding about these chronic diseases and what causes them. And there's very strong evidence. These are not my ideas. I didn't invent this or discover this. This is science that from the literature, and in the book, we show the published studies, the controlled trials. But I believe the evidence is very strong that these chronic diseases, there is something that works on the root cause. But more than that, I actually did it for myself. So I changed my own lifestyle and made some relatively simple changes. And what happened? After not that long a period of time, I went back to my doctors, redid more blood tests and did testing, and they couldn't believe it. They thought the machines were broken. But long story short, I was able to get off all these prescription drugs and essentially reverse these 4 chronic diseases by doing lifestyle techniques. And these lifestyle techniques address the root cause of this whole constellation of chronic diseases. And furthermore, they do something that no pills or surgery can really do, and that is make a difference in how these diseases affect us, and actually delay their onset or even reverse them, as we've seen. So I've made it my mission now going forward to help others take back their health and hopefully not make the same mistakes that I made.
Yeah, and what were those 4 chronic diseases, if you don't mind sharing?
Sure, absolutely. And the first one was a type of arthritis called gout. The second one was high blood pressure. And today in America, where I am at least, and probably true where you are in South Africa, most adults have high blood pressure or are being treated for high blood pressure. It's over 50%.
Yeah.
So that was the other one. So I was in good company. The third one was abnormal blood lipids, elevated blood lipids that required another drug. And the fourth one was diabetes, type 2 diabetes. My blood sugar was high enough that I was given that provisional diagnosis of pre-diabetes essentially. But those were the three diseases, and at first glance you think, well, how could they be related? Arthritis and high blood pressure and diabetes. Well, those are different diseases, but actually they're driven by the same metabolic dysfunction. That lifestyle is so powerful in controlling and reversing.
Yeah, and we'll talk about those lifestyles, but it's good that you now have done it yourself and that you went from pain to purpose. But I do want to talk about people are listening now saying, I trust my doctor. I've been with my doctor for so long. Do I find someone else? The doctor in South Africa, the average, general practitioner or medical doctor consults 12 minutes. I think in America it's 7 minutes. So they're not really trained to sit down and say, what's your sleep like? What's your nutrition like? What's your relationships like? How are you managing your food? And I mean, your mom was a traditional nutritionist, from what I remember, and you were supposedly
Yeah.
doing all the right things based on the trusted science, and you ended in this position. So I just want to know what your sort of process is for people that are listening out there because we can't be aggressive. I've been a physician doing functional medicine for 18 years, and sometimes I get frustrated with traditional Western doctors. Like even your doctor could have said, there is research for lifestyle. I'm not going to help you. Here are the pills. But yeah, go ahead and do it. But it seems like it's just closed ranks. There's no acknowledgement of anything else. What is your perspective with regards to how patients and clients that are listening out there, do they sit with their physician and say, listen, here's my coach, or do they get a coach, a health coach? What is your frame that you see?
Yeah, I think great question. And my thinking has really changed about that in two ways. First of all, even though I'm a physician, even though I'm a doctor, I now realize that doctors don't really make me healthy. Doctors just make me less sick. The the healthcare system is about disease. So, if I have a disease, I go to the doctor. And if it's an acute disease like a, fracture or, automobile accident, Western medicine's really good at that. These chronic diseases, not so good for the reason we talk about in the book. So first of all, if we want to be healthy, the doctors may not be the right place to go to it for all the reasons you say. Doctors are designed to treat certain diseases, but not necessarily prevent diseases or keep people healthy. And I think health coaches and other systems may be the answer. I'm not sure that the doctor medical system is really the way to do it. And for one other reason too. The second thing is that I used to think of these diseases as being like an on-off switch. You either have the disease or you don't. And some people get diseases and some people don't. That's just the way it is. And that's the way our medical system is certainly set up for reasons of insurance payments and, just for the system to work. You need to have a cutoff point. For example, when your blood sugar rises, it rises, and then at a certain point it crosses a threshold, or your hemoglobin A1C, these blood tests. When it crosses that threshold, you have type 2 diabetes, and before that, you don't. But it's not that black and white, and it's not just something like diabetes. It also happens with other diseases like Alzheimer's disease. It's not like, oh, you forgot your keys, you've got Alzheimer's disease. What I think the evidence is very strong that I now believe that that literally all these chronic diseases, they don't begin when the doctor diagnoses them in the office. Oh, you have Alzheimer's disease. Oh, you have cancer, or you have mental illness. These diseases, for the most part, begin years to literally decades before the doctor makes a diagnosis. So what does that mean? Well, to your question, if we wait until the doctor makes a diagnosis to begin lifestyle changes and having a healthy lifestyle, we've missed a tremendous opportunity for prevention and arguably pushing these diseases further back. So really having a diagnosis and then doing something about it is not the way. We should all start doing these things. I mean, I have patients, some older patients that they say, "Hey doc, I don't have any diseases. I don't have any diagnosis. I'm not taking any pills. So whatever I'm doing, I must be right. So I'm not going to worry about lifestyle right now because I'm not sick." Well, actually, we're all on the road to these chronic diseases. As it turns out, not only are these chronic diseases the ones that are, taking over our healthcare system of everyone's being afflicted by them. Not only that, but the diseases that I just mentioned are statistically the most likely cause of death for you and I and most of your listeners. It's a short list statistically.
Yeah.
What does that mean? It means as Jim Morrison said, nobody gets out alive, right? So we're all going to get one of these diseases sooner or later. And the question is, do I want to have that heart attack when I'm 45? Or do I want it at 65? Or do I want it at 95? Or I don't want it at 120, And by doing lifestyle things, we can, I believe the evidence is very strong that, in many, if not most cases, we could push that back.
Yeah, for sure. And so what I'm hearing from you, because, the biggest problem I have is mindset, is that patients come in, they service their cars before it breaks down. They don't wait to break down on the side of the road. They've got a financial plan in place. They've got a retirement plan in place. They know how much money they want to have. It's all a plan based on data, based on the assessment. But when it comes to their health, they only respond very similar like to you. Oh, now I've got chronic diseases. Now there's pills. Now there's a pain point. And now that's going to move me to change, which sometimes great that you did it but for many people, they just accept that from their doctor. They don't do anything, or they don't believe they can do anything. What is going to change? Is it a new generation coming through? I've done a lot of education in schools, universities, trying to educate people to say, yeah, your doctor hasn't done a fasting insulin. Yeah, you could have a high insulin, fasting insulin for 10 years. But is it going to be the doctor that's going to do that? Because now it's functional medicine. We're part of the South African Society of Integrative Medicine. We just don't have enough doctors. It's expensive. I know it's expensive. My colleagues in the States as well. How do you see this playing out? Because we're in this precarious middle ground where some of the Gen Z guys are saying, I'm 28. I want to check my free testosterone. I want to know what my DHEA is. I want to know what my fasting. But now someone's in their 30s or 40s, their mindset can't change from a preventative model to a sick care model. How do we address this in-between stage?
Well, I think things are changing, but I agree with your characterization. Really, it's a challenge, but I think things are changing, certainly in the U.S. and I think it's worldwide too. For the first time this year, we've had politicians at a national level have a discussion about seed oils and metabolic health and chronic disease. Suddenly, it's on people's radar, and people can realize that it's possible to influence these diseases. And the idea that we go to doctors when we're sick, but if we want to be healthy, that's on us. And it's that more and more people are becoming aware of it. So who's the physicist Planck? Max Planck said famously that, science advances one funeral at a time, as the old people die off and then new theories come along. Well, I think that may have been true back then when he was alive, but I think today, fortunately, we're advancing much faster. Again, referencing the internet, artificial intelligence, knowledge is increasing faster and faster at an accelerating rate. We finally have driverless cars now, and I just go around. I don't drive anymore.
Wow.
My car drives me around. We're on the verge of an iPhone moment with humanoid robots. They're saying in the next 18 to 36 months, they're going to be in our homes. They're
Wow.
going to transform our work. This is also happening in medicine and healthcare. So I think things are changing, and hopefully it'll be fast
Yeah.
enough.
Do you think the AI revolution is going to do it? Professor Tim Noakes has been on the podcast twice, and he's got a rich history of fighting, just this unfortunately nutritional dogma that's out there. And he took on a big fight, and it was a very hard fight for him, not accepted in the universities, right now. And yes, he's had a revolution, but it's been very difficult, and traditional Western doctors have not taken on his paradigm with regards to lifestyle. Also, he had type 2 diabetes, needed to change it, was a marathon runner. But do you think AI, those that embrace AI are going to then going to upload their labs? It's going to integrate their sleep data. It's going to integrate their exercise data. Then all of a sudden, the AI is going to say, all right, these are the parameters you need to work on. Your ferritin's too high, your free testosterone's too low, your vitamin D is way too low. Do you think that's the revolution that's going to come to empower the consumer to say, I'm going to order my bloods through direct consumer because AI has said I need to do this? Do you think that's the way forward?
Yeah, I mean it, and truly, the large language models are revolutionizing things, and generative AI. And there's one company. Actually, there are many companies. There's one company though that it takes data from a ring. They have their own branded ring. It's not an Aura ring. The company's called Rio, and they have a ring, and then it also hooks up to the CGM. It takes my blood data, my genetic data, and then I have an LLM on the phone that I can talk to what I've eaten, this sort of stuff. And I go, hey, you know what? I'm feeling tired today. And it'll say, well, guess what? Your blood glucose is 190. And you only got 4 hours of sleep last night, of which 12 minutes of it was REM. So what do you think? And also you stopped walking now. You usually do 7,000 steps. Today you're at 2,000 steps. What's going on in your life? So that kind of feedback is it's here already, and more companies, everybody's putting LLMs now on their things, but it's going to go even deeper. There are companies now. I mean, Sam Altman from OpenAI has already talked about this, but there are a number of companies that will go beyond just the wearable data, and they'll begin tracking location data from our phones. They'll be able to access all our emails, all our social posts, basically our whole life. And it will like understand through sentient analysis. Oh, your emails, are usually funny, and you talk to your friends with a happy mood. Now you're very depressed. What's going on? And oh, you usually drive to the gym every morning. Now you're going to the liquor store and the strip club. What's up with that?
Yeah.
So, and I think these things are going to be transformative in managing our health. The danger is, of course, that it again, it's the knowledge that they're trained on. So the advice the AI may give you is, oh, you need a low fat diet, and and
Exactly.
eat more carbs,
Yeah,
stuff like that,
exactly.
which I disagree with, but that's the problem out there, that even today, medical information, there are intelligent people who disagree on what a healthy diet is. Everybody agrees we should all lead a healthy lifestyle, whatever that means, but nobody agrees on,
Exactly.
there's a lot of discussion about what a healthy lifestyle means. And of course, the devil is in the details.
Devil's in the details, but also there's science that seems to contradict. And does that become personalized, which is really, really important? And then does my AI, can I have, Dr. Robert Lufkin? Can I have Dr. Peter Attia? Can I have Dr. Mark Hyman? Can I have those three doctors that are synthesized for my AI, my LLM, in terms of making sure that it's the feedback that I want to get? Otherwise, it could spit out, hey, you need far more carbohydrates and you need far more sodas in your life.
Yeah, you could do that, and Mark and Peter are friends. They're good people. They're very smart doctors, and but people disagree. Peter Attia has a different viewpoint about LDL cholesterol and its association with heart disease risk. He has a different opinion about weight loss and calories in equals calories out. There are differences even among the three of us. And the question, and the AI will, either note that or say,
Well,
hey, you could take advice A, B, or C.
yeah. All right, let's get into the book because I think you've said I think there's many books in you, 14 books. I think this was an incredible book. And I mean, I actually want to do it right now if you're listening out here, because I honestly can say between, Outlive of Peter Attia and this book, these are the two books that I take into corporate South Africa, Doc. And these are the two books that I'm recommending everybody buys. We brought more Oura rings into the country than anyone else. We brought more Whoops into the country. So we have a conversation a little bit about this company that you're talking about, because I really like it with using a large language model there. But just so that you guys can hear the metabolic lie, the obesity lie, the diabetes lie, the fatty liver lie, the hypertension lie, the cardiovascular disease lie, the cancer lie, the Alzheimer's lie, the mental health lie, the longevity lie. And so anyone out there, like, Dr. Lufkin said, one of these, you're going to get, or a subset of one of these. So tell us which you think is the most, well, not bad, but egregious lie out there, because I think that covers a lot of these diseases, the foundation of a lot of these complaints and chronic conditions.
Yeah, I think one of the foundational diseases is type 2 diabetes, and like we said, it doesn't begin the day we get the diagnosis, but it begins years to decades earlier. There's one other nuance about that my thinking has changed also. Again, I thought it was an on and off switch, but now maybe it's a long switch that goes back 20 years. But still, at the end of the day, some people either get diabetes and some people don't. There's some interesting studies that we talk about in the book of adult Americans who are non-diabetic, and this applies worldwide, I think. But if we look at their glucose markers, specifically hemoglobin A1C, which is a diagnostic criteria for type 2 diabetes, when it gets higher and crosses the threshold, you have type 2 diabetes. So if you look at these non-diabetic adults and we look at their hemoglobin A1C with age, it gets higher and higher and higher and higher and higher. So what does that mean? And I take it to mean that type 2 diabetes for many, if not most of us, is on our horizon. In other words, it may be like gray hair or wrinkles. In other words, if I don't die of something else first and I live long enough, and we should all plan to live a long time because that's what's coming. And, now, if I live long enough, I will eventually get type 2 diabetes just because my hemoglobin A1C will go up. And that's what the population numbers say. So that it's really on potentially all of our horizons. So we should all, or most of it, we should all have a healthy lifestyle. But one of the things with type 2 diabetes is the treatment that is recommended by our trusted medical institutions, the American Diabetes Association and worldwide associations follow this. They recommend that type 2 diabetes is treated with a number of drugs, starting with metformin and other drugs, and eventually insulin. As the pancreas wears out and the ability to control blood glucose drops, we have to add insulin. The problem with that is that, well, first of all, let me say, I'm not recommending anyone stop any of their medications that any physician has prescribed. This needs to be a conversation between the patient and the physician. And the other thing is, insulin is life-saving. With type 2 diabetes, if your blood sugar gets too high, you will die. And it's an immediate acute effect of hyperglycemia. and insulin can control that and save people's lives. So it is life-saving. The problem is once we begin controlling these high blood sugar things, type 2 diabetes becomes a chronic disease and it progresses into many other things. What other things? The number one cause of surgical amputation is diabetes. Toes, feet, this kind of thing. The number one cause of kidney failure, renal dialysis, is type 2 diabetes. Number one cause of retinal blindness in younger patients is diabetes, and on and on and on. It's a risk factor for cancer, much higher cancer rate, higher heart attack rate. Alzheimer's disease is referred to as type 3 diabetes because of the glucose problem. So when we treat diabetes with these recommendations from the American Diabetic Association and traditional medicine, we save people's lives, but we turn it into a chronic disease where they do go on and get amputations and blindness and heart attack and all these things like that. In fact, and the problem is there's another way. Type 2 diabetes is as we said, a problem of glucose metabolism that's driven by high insulin from chronic carbohydrate ingestion. Some people say it's carbohydrate toxicity. Of the 3 macronutrients, as your audience knows, fat and protein are required for life. We need those. The third one, carbohydrates, are not required. There are many human civilizations, or a few, that don't eat them at all. But carbohydrates are the primary driver of insulin. So and it's been shown now in controlled prospective studies that the majority of patients, if they go on a low carbohydrate diet and just cut out carbohydrates, they can lower their insulin dose and reverse their type 2 diabetes in the majority of patients. So you have a choice. You can either take the pill, the injection, or you can change your diet. The problem is, as I said, when you take the pill and injection, the chronic changes of diabetes continue to progress in most cases, most of them. The interesting thing happens if you reverse it with diet or lifestyle, as we're talking about, the disease essentially stops. It doesn't progress. You don't go into renal failure, all these other things. You stop the disease, you reverse the disease, if you will, and you get off medications. So why are people even given the choice there? Yeah. Well, the American Diabetes Association on their website has recipes for patients, and the recipes contain, some of them, large amounts of carbohydrates or sugars. And their recommendation is just, quote, cover it with insulin. In other words, protect yourself so you don't die of hyperglycemia, but still you carry on. And some people are even saying that insulin itself at high doses is harmful for all sorts of reasons. But if you look at these recipes, they're sponsored by, in one case, DaVita Corporation, which is a large sponsor of the American Diabetes Association. DaVita Corporation is one of the leading dialysis companies. In other words, they benefit from people who, put sugar on their food and cover it with insulin, with diabetes. Yeah. So this is an example of where Western medicine treats the symptoms, but the underlying disease continues to progress. And, you can go on with all the other diseases. If I get a heart attack, I get a stent, which, opens the blood vessel, but it doesn't do anything with the underlying cardiovascular disease. In other words, I continue to go on and on and on and on. So I think that's kind of an overlying lie across all of them. That metabolic disease isn't important, and if we treat the symptoms, then we don't have to worry about anything else.
Sure. Yeah. And so, I know you speak about refined carbohydrates, seed oils, and grains. And we had Dr. Pulmata also on the show talk about grains and the grain brain, which was powerful. We've had a lot of episodes on those nutritional areas. Maybe you just want to unpack what tests would help people. I know you're wearing a CGM, a fasting insulin, HbA1c, maybe an HSCRP, inflammatory markers. Someone's listening and saying, you know what, actually, I haven't been doing those things. I'm not sure where I'm at. What should I ask my doctor with regards? Do they do a coronary artery calcium score? Do they do, I know I had someone on talk about clearly a DEXA scan. What are the things that you look for this sort of metabolic function?
Okay, yeah. The basic thing you can do is there are five tests that you can do. Some of them you don't cost anything. But Gerald Raven from Stanford many years ago, when he described syndrome X, or what now is metabolic syndrome, he described five things. If you have three out of five of those, you have this syndrome. But actually, I would submit if you have one out of the five, you have metabolic dysfunction. And to give you an idea how widespread this is, studies in the US have shown that 80, almost 90% of people have at least one of these metabolic dysfunction markers. So what are they? Abdominal girth, like how big your waistline is, just basically obesity or overweight. The second one is blood glucose level. So that's a test you could get. Third one is triglycerides, which is a blood fat test. Fourth one is HDL, which is a blood fat test. And the fifth one is blood pressure, hypertension. Those things you can start off with those and checking those out. But then, as you mentioned earlier, glucose is a relatively insensitive marker for for glucose metabolism, because you can have the glucose is controlled by the insulin. The insulin protects the body from the damage that the glucose causes in the bloodstream, and the insulin is produced in the pancreas. So if we have higher and higher levels of glucose, the insulin from carbohydrates, the insulin will rise to control that. And we develop what's called insulin resistance or type 2 diabetes. The insulin keeps getting higher and higher. But the problem is the insulin keeps getting higher and higher, but the blood glucose can be in control. So you can have a normal blood glucose, but very high levels of insulin. And that's why it's so important to take a fasting insulin. And it's amazing that doctors don't test it, and it's really a blind spot. So fasting insulin is really important. You mentioned CGMs. A blood glucose test is valuable, with the caveats we just mentioned. But the problem is, or rather, what's usually done is a hemoglobin A1C, which is an average over 90 days of the blood glucose, just because it's convenient. You don't have to fast for it. And the problem with the hemoglobin A1C, it's an average. So your blood glucose can be going like this with very high peaks and very low peaks, but the average is normal. So even the high peaks are dangerous, and that's the value of a CGM, a continuous glucose monitor. You can see those high peaks as well. So
sorry, Doc, I want to just stop you there because there's a lot of discrepancy about having these high peaks of glucose. It's my belief, basic belief, just what I see is that it damages the endothelial tissue. But there's other people saying, no, having a high peak, is no problem and it's part of life. And what is your view there?
I think, glucose is, insulin is an important hormone for many things, but its primary function is to protect us from the damage that glucose does. And if our glucose shoots up, the insulin kicks in right away. There's a reaction that doesn't require a catalyst, that's a glycation that causes that sugar glucose actually binds to proteins in our body, and that's what the hemoglobin A1C is. It's glycation damage to red blood cells. But it's not just the red blood cells, it's throughout the body. So my opinion, high blood glucose levels are damaging, and we should try and avoid those with our lifestyle or with medications.
Okay, so I know Casey Means is in the public eye now, but I know that looking at companies like Levels and that having soft rolling heels, if you've got a CGM, not having these massive high spikes and these hypoglycemic events. Is that a basic summary?
Yeah. Casey's a friend. She's a great gal, and I'm so brilliant physician. I'm so thrilled she's now nominated to be the U.S. Surgeon General, which is an important spokesperson position in influencing public health and the people's ideas about wellness. So she'll be great for that. But yeah, I agree. I agree. It's better to have lower rolling things than these big high spikes.
Brilliant. I know you speak a lot about statins in the book, and for those that want to, I think it's crucially important to get the book. But let's just talk about ApoB, because there are physicians out there that say it's crucially important. What is your view of things like ApoB and lipoprotein little a with regards to cardiovascular disease? Because here we know you trusted the science, I say it again, you trusted the science that couldn't be trusted. Now there are physicians that are saying out there, even functional medicine physicians that are saying, ApoB is crucially important, and others saying it's not that important.
Yeah, I mean, this whole space is evolving so rapidly, and Pete, this is one place where Peter Attias, strongly believes in lipids as foundational for cardiovascular disease damage. I think they're important, but if we look at the hazard ratios, the risk factors, I think there are other things that are more important, like metabolic disease. And so what does that mean? It means that a fasting insulin, triglycerides or HDL is a greater risk factor for a heart attack than LDL. And the fractionation, I think, is evolving, and it's going to add more information. But if we look at it, I think well, clearly the message we can take is that dietary. No one disagrees anymore that dietary cholesterol is a problem. We used to avoid eggs and everything. There's still a discussion about saturated fat. I believe saturated fat is healthy and it's not a problem. There are other, intelligent doctors who believe it is, but our underlying markers are evolving very, very rapidly, and I think we need to take a close look at this. ApoE4, the gene for Alzheimer's disease, which actually was the common gene in humans ancestrally up until about 12,000 years ago. This gene is not really an Alzheimer's disease. It's a neuroinflammation. It's an inflammation disease and a lipid processing disease. And so, not surprisingly, people with the ApoE4 allele, which is the so-called Alzheimer's risk allele, most people have ApoE3 and some have APO2, but the ApoE4 allele not only increases risk for Alzheimer's disease, also for cardiovascular disease and endothelial damage. The question is, why would we ancestrally have this gene what's the survival advantage? Well, the obvious answer is parasites, infections in the brain. You want to have rapid brain inflammation that kicks in quickly. Similarly, if I'm in a world where I bleed a lot, I want to be able to clot off my blood vessels rapidly, and also infection and parasites there. But now in the 21st century, these genes, which previously were advantageous, now increase our risk of these degenerative diseases in the brain and heart attack and stroke.
So if I have to summarize, there is ApoB is important to you, but it's not the most important because of the hazard ratio. So you're saying looking at an HDL or even a visceral adipose tissue, we've seen a lot of our clients and patients for a DEXA scan. You would say with regards to the hazard ratio and the risk for someone listening out there, rather get your visceral adipose tissue down, rather get your HDL, maybe even something like a HSCRP down. Those are far more important than having a look at your ApoB status. And the second part of that you can answer is, for some people taking saturated fats, their ApoB skyrockets. For others, it doesn't. You might find that the LDL, increases, but the ApoB doesn't increase.
Yeah, and you mentioned there too, the HDL should be high. High HDL is good and low HDL is bad, versus the other ones when it's the other way around. All these things measure our risk for heart disease, right? And our genetic risk we talked about, our blood panel, all these lipids, these NMR fractionations of lipids and everything, our family history. These are all risk factors. They all play a role, but as you hinted at earlier, there's a test that doesn't show me my risk factor, but tells me if I have heart disease, and that's a CT calcium score. And I think everybody should have that over 30. Just why? Because if you identify it, one, for some people, it gives them added motivation on their lifestyle. Suddenly it becomes real, and this test, you can follow it up and see if what you're doing is working. Now, sadly, you don't reverse it usually because the calcium is more of a scar. Although in some patients, they do get a little reverse, but if you just stop it from progressing, that's a win. You mentioned the Clearly scan or the CTA, which is a completely different type of test. It both run on CT scanners, but the calcium score is relatively low dose radiation, takes about 15 minutes. There's no needle injection or anything like that. It can be repeated even yearly if you want to. And I have many patients that are doing that. The problem with the CTA, on the other hand, it's called a CT angiogram. It's also the heart, but it requires much, much higher dose, roughly 10 to 15 times what a calcium score is. So wow. The recommendation is this scan should not be done unless you have symptoms, unless you have, chest pain, cardiac symptoms, basically. The other problem with it's not just the radiation dose, is you also get an injection for a CTA, which is an iodinated called contrast agent. It's relatively low risk, but the risk isn't zero. There's, the risk of anaphylaxis and death is 1 in 30,000. Now that's a really small number, right? But if you're the one, it becomes a big number, and getting an injection includes risk. No one has ever died of a calcium score because there's no injection. Yeah. It's not even, one in, pick your number. So I want to separate the CTA and the Clearly processing on top of that, in my opinion, should really be only for symptomatic patients. If you have a symptom, then it justifies the risk from the radiation and the contrast. And it shouldn't be repeated more than, every 5 years or so. Whereas the calcium score is kind of a healthy wellness thing that you could do as frequently as once a year if you want, if that's going to be benefit. And there are a lot of other things you can get from that scan. We're now doing liver fat density, looking at non-alcoholic fatty liver disease. We actually do a percent liver fat off the CT calcium score, and we record that. We also do bone mineral density off the CT calcium score. So we do DEXA values, Z-scores, and T-scores off of that. So you can get a lot of information from it.
Sounds very powerful. And you're listening out there. DEXA is now available in South Africa, which I think is fundamentally important. So shoot us a DM about that. So I'm going to push you a little bit here, Doc. So do you look at ApoB or you don't look at ApoB?
I think it's good to have, I'm like Peter, more information is better. And the problem is, applying it to each person, because we're all individual, the things in the book, The Lifestyle, as it turns out, they work for almost everybody. But within that, there is granularity. Some people, can't eat dairy. Other people choose to eat only plants. Other people choose to eat only animals, and we're all variations. But I would definitely check it. Yeah. If there's a cost, so yeah.
I just want to finish quickly. I know we're coming to the end of the show, but I think you had Dr. Katie Deming on your podcast, and we'll put podcast links to yours. I know it's a very popular podcast worldwide. But in terms of cancer, are you looking at it from a metabolic perspective as well? High insulin driving, mTOR, that driving cancer. How are you addressing this, and what are the most important people can do? The cancer rates are skyrocketing. By 2030, 1 in 2 people will get cancer in their lifetimes. I think it's 1 in 2 men now, 1 in 3 women. Having Katie and some of her colleagues on the show, what's your sort of most important intervention?
Well, I think and this is for cancer prevention. So, obviously smoking, we do a cancer screening, colonoscopy, those recommended things. But then in addition, the lifestyle, because the healthy diet, the sleep, the exercise, all those things are going to, in my opinion, lower our risk for cancer, because we're seeing already the healthy metabolic state, which is ketosis in a lot of patients. The ketogenic state reverses some Alzheimer's disease, not all, some mental illness, not all. Certainly type 2 diabetes, it does, and across the board. But interestingly, with cancer now, we're seeing the first evidence that ketogenic diets can significantly affect outcome. The study just published on malignant brain tumors, glioblastoma multiforme, showed that on the ketogenic diet, they dramatically increased their survival. And that's not instead of chemotherapy or anything else, but it can be the beauty of these lifestyle things. There's really no downside for most people. So why wouldn't you want to try a ketogenic diet if you have mental illness, or if you have Alzheimer's disease, or if you have, take your pick, any one of these chronic diseases, and cancer is in that list. And I think we're going to see more and more metabolically healthy lifestyle and metabolically healthy diets are going to be employed routinely as part of cancer therapy, just like we're beginning to see for mental illness, that psychiatric hospitals across the country are beginning to adopt metabolically healthy diets and lifestyles.
Yeah, it's powerful. And I saw that you had Dr. Dale Bredesen recommend your book. He was on the show, and we ran his cognoscopy process here. We've got some health coaches that are ratified. So I think that's moving in the right direction. I'm not sure about the oncologists. They seem to be the hardest specialty to crack. They don't look at diet, don't even consider fasting and these things. But like you said, if we've got a UCLA and a UCA professor starting to speak up, starting to write books like this, starting to educate, we're starting to use AI, there is hope with regards to a change, change using lifestyle before you have to develop, medicine 4.0. I've taken a bit from Peter's medicine 3.0, but the last one is, and I'll say it again for guys listening, preventative medicine, proactive, personal, and the last thing is performance enhancing. We want you guys to perform as best as you can. Maybe give us just one short little, like something that we haven't mentioned about the lies in the book that you'd want people to hear just before we end.
Yeah, I mean, everybody asks me, and they say, "Boy, after writing that book, aren't you depressed?" About all the things. And you know what? I'm not. I'm very hopeful, because I feel like it's a new era, a new relationship with our health. In other words, I still trust my doctor. I still go to doctors, but I realize that doctors, like I said, can't make me healthy, that I'm in charge of my health. I as a patient am in charge of my health. I am the CEO of my own wellness, and the choices I make every single day about lifestyle are going to be more powerful than most pills or surgeries that I'm ever going to be given. And it's a choice I get to make every day. When I wake up, I get to decide what I'm going to eat, when I'm going to eat, when I'm going to exercise, and the lifestyle that I choose. And that, to me, I have agency. It's in my hands. That's very empowering. And I think that is going to change the world of health as more and more people adopt that.
Yeah, and I absolutely agree. And I think education and awareness. I don't know if you've had Dr. Gator, the integrative pediatrician, on your podcast, but incredible.
No,
Gave stats that 40 to 50% of American children, those that are under the age of 18, have a chronic disease. So we're looking at significant numbers and very well researched, but we can chat offline. I want to just declare favor and blessing over you, that you would rise up in your calling, that you start and carry on speaking boldly. I love your presentations, love your podcast. Thank you for taking this on. I hounded you on LinkedIn, but sometimes if you want to get great voices, my mentor used to say, he's in Fort Myers, he said, keep knocking, be respectful, keep knocking. And so I can't thank you for enough. I know how precious your time is. Please, we'll get the links. Maybe where can people find you? I mean, obviously to get the book, but where can people find you?
Oh, yeah. My website is robertlufkinmd.com. You can download a free chapter of the book and see if you like it on the website. I'm active on social media. My wife tells me too active, but please say hi if you're out there. We'd love to hear from you.